Now, the Southern Health and Social Care Trust's Acute Care at Home service is apparently offering hospital care to older people either in their own home or in their nursing or residential home. It's a pilot service and it's prevented apparently 400 hospital admissions. Let me speak to Angela McVeigh, who's the Director of Older People and Primary Care for the Southern Health and Social Care Trust. Angela, good morning.
Good morning, Frank.
So 400 people during this pilot run, 400 people who would have been in hospital didn't have to go there, is that right?
That's correct. The service started last year in September, and in that time we've been able to prevent 400 people having to go into hospital, and also facilitated about 100 people who were in hospital who we were able to bring out a wee bit earlier back into their own home again.
Now, some people might say, I've paid my taxes all my life, and the moment I needed to go into hospital, they didn't provide the service.
Yeah. I think I just need to make it very clear. This service is not about preventing older people going into hospital if that is the care that they need. Absolutely not. But we do know that for a lot of older people there was no alternative. And for example, if they got a chest infection or went off their feet, that was the only option available to them. Now we're able to provide a consultant-led, a geriatrician consultant-led service. We have a multidisciplinary team of specialist nurses, specialist physios, occupational therapists, healthcare support workers. We've got a pharmacist and senior doctors, and that team are able to work with the older person and their family and provide hospital-like care within the home, but it always has to be safe care, and that would be the first requirement. And when the assessment is made by the doctor, by the senior clinician, if the senior clinician recognises that this care would be best provided into a hospital, then that's what will happen. But what we've been able to do is very successfully support a large number of older people who previously there was no alternative for them but to go into hospital.
So someone who needs a special bed or needs to be on a drip, will they automatically be in hospital? No,
we're able to provide that service very, very safely in the home. We have a wide range of hospital beds and other equipment which helps support people in their own home anyway. And a lot of the older people that come onto the scheme, because some of them will have infections such as a respiratory infection or a urinary tract infection, we do provide that antibiotic cover, including the IVs or IV fluids. We can provide that service into the patient's home as well.
Are you getting a sense from the research over the first year that the patients prefer to be in their own home, or do they wonder why they're not getting what might be described as, in inverted commas, proper attention?
What we are finding is an overwhelming sense of that the older person and their family want that older person to stay in their own home, or indeed a nursing or residential home if that is their home, because they're in familiar surroundings. We've got familiar people who are taking care of them, and what we're finding is that sometimes what can happen when older people who are poorly go into hospital, it can be very disorientating for them. It can lead to confusion and delirium, and can actually extend their length of stay within a hospital environment. And we're getting very positive feedback from the older people themselves and from their families, and indeed from the GPs who have been referring the older people to this service, and it's coming back very, very clearly that this type of service is supporting the older person very well, and everyone to date has really given very positive feedback.
Does it cost more money than a person being in hospital?
No, it doesn't. It absolutely doesn't cost any more money. The service has been funded because it is a new service, and we've been very fortunate. We've been very well supported by the Southern Local Commissioning Group and by the Southern Integrated Care Partnerships. And what we have found is that working with our funders and working with older people and other key stakeholders in the community, particularly GPs, we've been able to develop this service and shape it over this last year, because we've actually now, we're not even calling it a pilot now, we're actually calling it, this is phase 1 of the service. We're moving now into phase 2, which is a further extension of the service, and eventually we'll be moving into phase 3, where the service will be available across the whole of the trust area.
So we're talking generally at the moment about Craigavon, Banbridge, Armagh, Dungannon. That's the general hub, isn't it?
That's correct. And in that area, we've also have 33 nursing and residential homes included in the service, which means that if you're an older person and you're resident in a nursing or a residential home, you have full access to this service, similar to an older person who's actually living in their own home. And we have been finding that working with our colleagues in the nursing and residential section, they are very supportive of this approach. They want to care for that older person in their own home, and we've been developing very good working relationships and supporting them, and again the older person and their family, to keep that older person in their nursing or residential placement.
Do you think it'll go province-wide quite soon?
Well, I know that other trusts have services either in place or developing services. I think where we have been able to develop our service differently was that we were the first service to have a consultant-led acute care at home service, and we think that has really benefited our patients. But we know that the direction and the strategic direction within Northern Ireland is to provide more services in the community, in people's home, which can be safely provided there, which means that we don't have to go into hospital. And what we're finding is that we're able then to use a whole lot of other community services which help support older people at home. And when they are discharged from the acute care at home service, we will signpost them on to other services that will help support them. Some of those we will provide ourselves within the trust, such as our domiciliary care services or our reablement services. But some of the services that we link into are those that are provided through the community and the voluntary sector. And we have a very strong and vibrant community and voluntary sector within the trust that do a huge amount of work to support older people in their own homes.
Okay, Angela, thank you for that. Angela McVeigh talking about what is no longer a pilot but has now been rolled out across the southern area. Will it be embraced right across all the trusts? Time will tell. Are you already availing of it with a family member? Do let us know. 90 333 105.